Acute Neurology video series. Let's discuss about stroke and the acute treatment of stroke. A stroke is a blood clot in the brain, just like a heart attack is a blood clot in the heart. When someone comes with stroke-like symptoms to the hospital, they almost always have a CAT scan of the brain. And the reason for the CAT scan is to make sure they did not have a hemorrhage, a bleed in the brain, that is, because that is treated differently. So once we are sure that they've not had a bleed in the brain, they are then eligible, if they come within a certain time, to get one of the clot buster medications like TPA or TNK. We are doing more TNK nowadays, and they have to come within a specific time, like 3 to 4.5 hours, sometimes longer, and they have to meet criteria to be eligible for those clot buster medications. Most of the patients, though, come after that time period, or they are not eligible for the TPA or TNK. So in that case, we usually do an MRI of the brain to try and visualize the stroke, because a CAT scan will not show the stroke for at least 48 hours, and it's not that effective. So we usually do an MRI, and then the treatment really is to give them blood thinners to try and reduce their risk of further strokes. We want to hydrate them as well. We want to keep them hydrated, and we do not want to drop their blood pressure, because we need to perfuse that area of the brain around the stroke, which is called the ischemic penumbra. So you don't want to drop the blood pressure unless it's really high, say it's higher than 220 by 105. And you also want to aggressively treat fever, high blood sugar. You do not want to give glucose-containing fluids to someone with a stroke, because it increases the metabolic demands of the tissue. And then once you have instituted the proper blood thinner, whether it's an antiplatelet agent or an anticoagulant, or change the blood thinner perhaps because the patient is already on a blood thinner, then and then you've gone past the acute phase, then basically it's physical therapy, starting a statin, starting an angiotensin converting inhibitor, perhaps even instituting an antidepressant. And the whole goal then would be to prevent any further strokes.